Pamela Beebe has spent much of her professional life advocating for truth and reconciliation. But in her personal life, she's had to spend a great deal of time advocating for her family's health care.
When somebody has to go to the emergency room and get sent home right away, nobody is surprised in my family. We get asked immediately, like, are you on drugs? Are you high? Why are your eyes red? Like all these questions around that are just not appropriate.
Beebe is not alone, and now new research published in the Canadian Medical Association Journal has found evidence that Indigenous people consistently experience discrimination within Alberta emergency rooms.
So some real hard quantitative data that systemic racism exists.
That's right, exactly.
Using data from Alberta hospitals, researchers found First Nations routinely receive lower acuity triage scores, important because patients with higher scores are given a higher priority for care.
What happens from the data that we see is that people who are from the First Nations community are put down lower in the list to be seen for those same types of injuries as people who are not from the First Nations community.
The Alberta research adds to a growing body of evidence that systemic anti-Indigenous racism in healthcare is a national problem.
We found pervasive interpersonal systemic racism.
A 2020 inquiry found 84% of Indigenous patients experienced discrimination within BC's health system. And of course, no one can forget the tragic death of Joyce Echaquan. The Atikamekw woman died in a Quebec hospital days after live streaming this video. On her chart, a nurse had identified her as a drug abuser in withdrawal. It wasn't true.
It makes us very reticent to access healthcare services, and we don't do so unless we absolutely have to.
Whether it's the researchers in the Alberta study, the coroner's report in Quebec, or the inquiry in BC, the key recommendations are the same. Systemic racism within the Canadian healthcare system exists, and a reckoning is overdue.
Whether they're nurses, doctors, respiratory therapists, security guards, everybody needs to gain skills in how to address their bias and be aware of it,
in order to ensure all Indigenous people have equitable access to care. Heather Yourex-West, Global News, Calgary.